program today, and I want to remind you, though, that only when we get to the question and answer session, only members of the press club or members of the working press can ask a question. And today we have another outstanding speaker. I want to introduce to the whole body here Dr. Libbie Sonnier, and she is the Executive Director of the Louisiana Policy Institute for Children, where she leverages her nearly 20-year career supporting young children and their families. Recognized for her tenacity and deep commitment to children, Dr. Sonnier has led teams in system-wide initiatives for the betterment of children, families, caregivers, and practitioners. Prior to taking leadership of the Louisiana Policy Institute, she served as state director of 2 federal programs, and she developed and implemented pilot programs for children birth to age 5 in 4 states across multiple agencies and community partners to improve the efficiency and efficacy of direct services for children. Libbie Sonnier, come on up and give your talk. Thank you for coming.
Good afternoon, and thank you so much for your time today. Again, my name is Libbie Sonnier, and I'm the Executive Director of the Louisiana Policy Institute for Children. We are an independent source of data and research and pertinent information really for policymakers, and we at the Louisiana Policy Institute for Children work tirelessly alongside our trusted partners as well as others to shed light on the state of early care and education in the state of Louisiana. Our top highlight from the 2021 legislative session was the passage of Senate Bill 142, which commits 25% of sports betting revenue with up to $20 million to the Louisiana Early Childhood Education Fund. We thank our legislative champions, especially Senator Rick Ward from West Baton Rouge, who helped us, as well as the Ready Louisiana Coalition partners, for their tireless advocacy on behalf of the youngest Louisianas and working parents of our state. This state investment really is a game changer for young children and families in Louisiana. The Louisiana Early Childhood Education Fund is a crucial tool in addressing the inability of many families to access high-quality early care and education in our state. The fund offers local entities a dollar-for-dollar match on investments in early care and education. Unfortunately, despite its creation a few years ago, as of June 1st, the fund only has about under $380,000 to match the efforts of New Orleans, Shreveport, and other communities who have come up with local efforts, local dollars to increase access to early care and education. This new revenue stream for early care and education through the fund will incentivize more local investments in early care and education. These combined state and local investments will help, in turn, more families have a safe, high-quality setting to send their children to while parents are working or in school, and provide recovering businesses a stable workforce at the end of the day. While the future investments in the fund, this Early Childhood Education Fund, are encouraging, these investments will not close the larger gap that we have for early care and education in our state. The continued underinvestment is especially disheartening. The state budget, to quote our friend Dr. Steve Procopio, is a value statement. As it stands now, the budget for the state of Louisiana tells us that there is a lack of value in young children, when we must turn to vice taxes to attempt to fund a system. Nearly 20 years ago when I started my career, did I think I would be advocating for sports betting revenue or the potential for medical marijuana tax? We know that investment in early care and education really makes a difference. It makes all the difference in the world to our children, to our state, and our economy. High-quality early care and education experiences are absolutely critical to young children, because what we know is that their brains, prior to age 5, 90% of their brains are developed. And so that these high-quality early experiences during these critical developmental years will set this tone for children to have success in school and in life. This past school year, only 40% of Louisiana kindergartners arrived meeting crucial benchmarks. That means 60% of our Louisiana children require remediation on day one when they go into kindergarten. Working families need access to quality early care and education because it's an economic driver. A recent study showed that the state's economy lost $1.3 billion with a B a year due to child care breakdowns, and businesses lost over $780 million a year. Accessible child care means we can prevent these losses in the future and then ensure a stronger economy for our state. Prior to the pandemic, quality, affordable child care was simply out of reach for a majority of our working families. Louisiana serves only about 15% of children birthed to age five using the Child Care Assistance Program, a state-funded program that provides affordable child care to working families. Quite frankly, COVID-19 only exacerbated the issue as the child care sector was devastated by the pandemic. The federal stimulus dollars arrived in our state just in time for some providers and is largely being used to stabilize the child care industry. Even with some of the federal funding being used to increase the access to early care and education for families who need it, it is simply one-time money. Once it's gone, it is gone. The one-time funds do not address the access issue for more than 117,000 children that are at risk in our state who need quality early care and education long-term. On top of that, the one-time nature of this federal stimulus money means that the state cannot fully invest these dollars to expand access and additional child care seats because they could disappear in just a few short years. If there is no plan on how to continue to cover costs of an expanded access for child care, once these federal monies are gone, the ability to utilize the federal stimulus money that we have coming in for COVID is really constricted. Our families, our businesses, and our economy depend on child care. Every single step that we take to increase access to high-quality early experiences will make a difference, again, for families, businesses, and the economic recovery of Louisiana. Now, as more and more employers are getting things back to normal and families are going back to work, one of parents' first needs is accessing quality child care in order to go to work. With 2/3 of our children birth through age 5 in Louisiana having both parents or their single parents in the workforce, child care is essential for our economic recovery. State investment in early care and education is necessary and a smart investment. You see, investing in early care and education yields a remarkable return on investment. It's 13%. I don't know about you all, but I know for me, I can't put my money anywhere and get a 13% return on investment. Continued coverage in your print editions and online about the importance of the state's investment in high-quality early care and education does wonders for our fellow Louisianians. This includes your editorial coverages in each of your markets across the state, and we have seen time and time again that the citizens of Louisiana truly value and trust the opinions of the press. And we can't thank you enough for that. So thank you for your time. I know we're busy eating, and I'm happy to answer any questions that you all may have. Yes, sir.
The passage of Senator Bill's bill, which required.
I'm sorry, whose bill?
The passage of Senator Bill's bill, required early kindergarten.
Kindergarten.
That's affecting what you're doing right now.
So the question was about the passage of the mandatory kindergarten bill by Senator Fields and if it affects the work that we do. How it affects the work that we do for children birth to 4 is this: we need to get them prepared to be ready to learn in kindergarten, especially now that kindergarten is mandated. So at the end of the day, increased investment in early care and education helps children be ready to learn when they enter into kindergarten.
Libby, can you repeat the $1.3 billion? Was that what providers lost?
The $1.3 billion dollar amount that I was talking about was the loss to the Louisiana economy because families don't have access to quality early care and education, and employers don't have access to a reliable reliable workforce. But what we know from our work at the Louisiana Policy Institute for Children is that collectively, this early care and education sector through COVID-19 lost $245 million. And we think that's a conservative estimate to really count how much this sector lost because of COVID-19.
And whatever money you get from sports betting, would that go into the early childhood education fund, and then it will probably be used to match what local communities come up with?
So the question was related to the sports betting revenue that's being directed towards the early childhood fund, and would that go to the fund and match local investment? The answer is yes. The funds from the sports betting revenue are directed straight to the early childhood education fund, which offers that dollar for dollar match for locals. So in New Orleans, they have invested $3 million of their city money in infants and toddler seats. In Shreveport, they have raised $1 million to come to the table for a dollar for dollar match to increase their investment up to $2 million. And these local investment mean more access in these communities. So more access to high quality early care and education seats for young children in these communities. Yes, sir.
How much are the estimates for how the sports betting will yield for potentially early childhood education?
So the question was, what are the estimations of revenue for sports betting? In the first couple of years, the total revenue is expected about $27 million, which would put about $6 million in the fund. My greatest hope with a cap of $20 million is that I have to worry about that $20 million within a couple of years. I really want to worry about that. But we'll be there. That'll take a little bit for us to get to the point that we need to worry about the $20 million cap. But this sports betting revenue is the single most, the highest investment that we could potentially realize in that fund at this time. Steve.
So, we're getting all this federal money. Why would the state need to put it in?
Great question, Steve. So we're getting all this federal money, and why would the state need to put any money in? In your package, you'll see really an illustration of why, and the explanation is this. These federal monies help start build the bridge and get us to about halfway of the bridge to build an early care and education system. But without state investment, we can't fully build the bridge that we need for an investment. Again, these federal stimulus monies coming in related to COVID are one-time money. It's one and done. We don't know if we're going to ever have this kind of money in our system again. And so these federal dollars need to be really used on infrastructure and how we think about how we want to move our state forward and be able to try some different things to make sure that we have a system that's robust and can meet the needs of our state as we grow. Yes, ma'am.
Do you think our universities are prepared enough for the number of teachers that we're going to need in pre-K to be able to handle that?
The question was related to our universities being able to handle the number of teachers that we need for early care and education. And so I would say this is what we have in our state is called an early childhood ancillary certificate, and that certificate is a child development associate's type of certificate with added supports that these teachers need. The majority of our early care and education teachers in child care centers are trained not in universities. They're trained at community colleges and through different avenues to make sure that they're certified at a level. The issue right now is that we do have a workforce issue within early care and education. The issue is this. Most of our teachers in child care make a little over $9 an hour. That's not a livable wage. And so what we're asking our child care teachers to do, and they're teachers in every extent of the word that we would say that somebody that has a bachelor's level degree has, they are teachers, is that they're under immense stress. And so we're asking our most vulnerable population, because they don't make a livable wage, care for our most vulnerable population, for our children. And so it's something that we think about often at the Policy Institute for Children with our partners around the state of how do we show that we value children and we value the workforce that cares for our young children.
Libbie, why is it that you think early childhood education doesn't resonate anymore with the legislature than it does?
So the question from Will was, why do I think that early care and education doesn't resonate with the legislature like it did? I think it still resonates with the legislature. If you wanted to get sports betting through, we were told time and time again by many legislators, sports betting revenue will not get through unless it has early care and education tied to it. And so I think it still resonates. I think the issue comes to when we're looking at our value propositions with the budget, that we still need investment in our budget, not just in vice taxes and whenever we can try to grab some new revenue. Fundamentally, if children are something we value in this state, we need to show it in our budget. And I know we've made investments in K-12 education and higher education, but we also need to make investments prenatal to age 4 as well to show that we're getting children ready to learn so they can enter kindergarten ready to go, and then they can get into the K-12 system rearing and making sure that we can maintain the growth that we see birth to 4 all the way up when they get into kindergarten and up to 12th grade. Yes, sir.
You may have covered this, and I've been having to do some of this other attention-taking things, but who are your primary partners with other organizations that are helping you, and will they partake in the funds from the sports betting portion that you get?
So the question was, who are our other partners that work with us really in early care and education, and who will benefit from these sports betting revenues? We have a coalition that we work with called Ready Louisiana. It is now over 100 organizations that include many chambers of commerce around the state, economic developers, if you think about Committee of 100, GNO Inc., those types of people, as well as nonprofits like the Louisiana Partnership for Children and Families, ourselves at the Policy Institute for Children, United Ways of Louisiana, that really advocate for increased investment in early care and education. And so those partners continue to help us move the ball forward to make sure that we're raising to the highest level that young children in the state are important to invest in. The people who will benefit from the sports betting revenue at the end of the day are the children of Louisiana. And so how does that get deployed? And so what happens is the money goes into that fund, and then when locals raise a dollar to match that fund, they draw that down through the Bessie board with the Louisiana Department of Education, and those monies are then allocated through what are called Ready Start networks. They're community networks within different parishes around our state, and then they allocate seats to local high quality early care and education centers that take part in the accountability system. Because we don't want these state dollars and these local dollars not to go into a system that's accountable. And so these dollars go into an accountable system that actually is number 8 in the country for accountability. So we're number 8 in the country in Louisiana in a really good way about accountability for young children. And that's where these dollars go, to these centers that are accountable. Yes, ma'am. So the question really was about the wages for our child care teachers at the end of the day, and how do we recruit them and how do we retain them, especially, I will say, in light of that we know many of our child care teachers don't have access to benefits. This is a continual problem that not just Louisiana has, but we're having nationally. And so part of the conversation we're having currently with the Louisiana Department of Education is how do we use some of these federal dollars that are coming into the state to figure out how do we incentivize these educators to come and work in childcare, because we know that they're critically important. And so that's the conversation we're having. The other piece of the conversation we're having is how do we build a system that's sustainable? Because we know prior to COVID-19 and even after, that the childcare industry is operating on razor-thin margins. They're not really profitable. People get into this business because they love children, not because they're making money. And so we're trying to think about what's a system look like that we can have livable wages for our teachers, where they have access to benefits, and so that they can provide the best care possible, so that our children have the best educators and care providers that they can. Yes, sir.
Dr. Zena, is he on your board? Are you familiar with that?
So the question was about Dr. Charliezina at Tulane University. We're very familiar with him. While he's not on our board at the Louisiana Policy Institute for Children, we work closely with him in his work related to adverse childhood experiences. Because what we know is when we invest in these early experiences, that's what matters. It's so that children don't have as many adverse childhood experiences, or if we can help it, not have any, so that they can learn, change, and grow. At the end of the day, we need to make sure children are healthy, and not just what we think about as like our overall health and making sure they don't have ear infections. We need to make sure that they're healthy, that they have food, and that their mental health is protected from really prenatal until they're born, and once they're here, that it's still protected, so that when children get into educational environments, that they are ready to learn and can be successful. But he's wonderful.
And how, is there another group that you maybe work with, like what John asked you about, that works on the out of wedlock births? How is Louisiana ranked nationally? I know it's just terrible nationally.
So the question was related to out of wedlock births. That is not something within the mission of our organization that we work on, and most of the organizations that we do work with are really trying to address the issue at hand, is when children get here, how do we make sure that they have what they need, as well as we work with other organizations that work on different topics of women's health and those types of things as well.
I see your group is critical to moving the needle a little bit with respect to crime, and I see the two as that's our problem.
Yes, sir. And so his comment was about our work at the Louisiana Policy Institute for Children related to early care and education being really critical to crime, and this thinking about unwanted pregnancies being really tied together. I will say this: what we know longitudinally from working with young children for the last 50 years is that when they have access to quality early care and education, we see many things. They don't tend to need as much special education. They are not retained. We see reduced rates of juvenile issues related to juvenile justice. And we also see that children that have access to high quality early care and education during those first 5 years of life have reduced rates of teenage pregnancy because they're really learning many different things when you have access to quality early care and education. You learn that your behavior has a consequence, and so there's that give and take reciprocity of learning. And so that we know that the long-term benefits actually into the middle age. I've had the great pleasure of working on one of the largest longitudinal studies in the country called the Abecedarian Project. And we just put out a paper in the last month related to the neuroplasticity of the brain. And what we also know is for children that receive this high quality care and education, in their mid-40s, there are structural and functional differences of their brain that go into their midlife, and that goes into their health, that goes into their economic stability. It also goes into how they view the world, that they view that they have control over their world and can make choices that really help them be successful adults at the end of the day. Yes, ma'am.
It seems like the matching money would be extremely important right now.
It is.
Do you all have some plan of action on that? Because there are only, as I know, 3 foundations in the parish school systems in Louisiana. Baton Rouge has one. St. Charles has one, and maybe Shreveport has one. Are you all making any kind of outreach efforts to the business and industry or other?
Yes, ma'am. So we work. The question was related to the dollar for dollar match, the early childhood education. We think of it as an incentive fund. So what are we doing, particularly as an organization, to reach out to local communities? We are. So what we're doing is we're meeting with different parishes across the state. I've got three meetings this week with different parishes about how to think about using local dollars to really be able to access this incentive fund. So to access the incentive fund, they have to be local dollars. They can't be federal flow-through dollars. It has to be local dollars. And it can be philanthropy as well. And so Shreveport raised $1 million through their community foundation. And so they're looking for that. We've got places like Ascension Parish that are looking at their juvenile justice dollars that they roll over a significant amount of money annually and how they can use that money to invest in early care and education. So we're working with them how to think that through. We have a new mayor in Monroe City, and he's thinking to Libbie, how do we really think about the dollars that we spend in this city to incentivize early care and education, and also to make sure like this is an economic game changer for our city. And so we're having those conversations all over the state right now. What's really exciting is that locals want to have this conversation. Like, we're out there and letting them know that they can do this, but they're asking us to come in and be able to help them think through that and how to set up something that's sustainable and not just one and done like federal monies are.
Any other questions?
What about Baton Rouge?
Working with Baton Rouge with your new superintendent, Dr. Cito Narcisse, to think about how we really invest in the system all over the parish for early care and education. And so he's really thinking hard about how we do this, and we're excited to work with him as well.
Does the Libbie have any stake in this? Are you getting any support?
So the question was about Libbie and if we were getting any support and if they have stake in this. I would say yes. We had an early education day at the Capitol, and Stephen Wagasback got up in the room and said early childhood is critically important to our economy. And what they do with their members is they give us access to their members to talk to them about the importance for their workforce to be able to come to work so that they can generate revenue, that it's important that they help focus on early care and education, which is greatly appreciated. Also, Jefferson Chamber, one of the largest chambers in the state and one of the most powerful chambers in the state, has put early care and education as a flag for them, as many chambers have around the state, as well as economic developers too. Thank you.
Thank you very much.
Dr. Narcisse is coming next. Dr. Narcisse will be our speaker next week from the East Baton Rouge Parish School Board.